I research about cancer survivors and heart failure in these patients, and then I treat cancer survivors with heart failure. And that unique kind of hand-in-hand research and practical experience is so complementary and so invaluable. And I really can see the impact of research and how it can improve people's lives.
It is very difficult to juggle both clinical and research responsibilities. I think all clinician scientists have this experience.
At a department level, at a exec level, at a government level, we're not thinking enough about this group of people who are really at the forefront of bringing in new treatments into clinical care.
So within the hospital setting, people's primary objective is service and getting people in and out and curing illness and so on. And research activities are often seen to be a bit of a nuisance and getting in the way of you providing that service promptly and efficiently.
In many departments, it is all too easy to just focus on service delivery day to day and to not really formally recognise what research is taking place and try and just get the clinical jobs done.
Having attention change to the fact this is something you should be doing rather than it's something that they're going to put up with you doing is something that needs to happen.
So that we can help more people see clinician researching as a viable career path, I think that really the big thing is providing ongoing support.
It feels like, you're often left alone and you have to face a lot of things by yourself, and it's your choice to do that, and a lot of that is in your own spare time.
Patients never have issues only on the days you're allocated to clinical work, and vice versa. Research priorities and grant deadlines are never limited to the days that you've allocated for research, so it's always a constant juggle.
And if you speak to any clinician researcher, it's protected research time that's just so critical.
You need the help of of research coordinators. You need support staff by statisticians.
Ethics requirements, governance requirements, all of the logistics and the agreements related to setting up research.
Having people who can navigate you through what seem like quite complex and overwhelming pathways when you're unfamiliar with them is really, really important.
To help raise the profile of clinician research, I think that really the most important thing is role models. So seeing people who are able to do it, who are ahead of you, and who are enjoying it and thriving in the role. We want to see people who are saying, wow, this is incredibly rewarding, and both sides complement each other, because they really do.
Career pathways are obviously really important for clinician researchers, and having those as well-structured and well-defined as possible is just so important. So a simple point to make is that there isn't a job description or a job title that says clinician researcher.
In Singapore and in the United Kingdom, they actually have dedicated clinician research positions.
All of your institutions, your research institution and your clinical institution, recognise that you have this integrated clinician researcher role.
And I think that model is something that's missing in Australia.
And so I think making space for a culture of research within departments always strengthens the department ultimately.
The role of a clinician researcher shouldn't be seen as an exception to the rule, but to see as like a necessity for a growing and improving healthcare system.
To unlock their potential, we need 5 key reforms. 1. Improve transparency. We need to be clear about how research funding is shared and ensure some of it goes directly to supporting clinician researchers. 2. Embed research in organisational priorities. We must make research a core priority in business plans, executive decisions, and department goals. 3. Protect time for research, enabling research time through smarter workforce planning, role design, and funding models. 4. Streamline infrastructure. We have to invest in systems that reduce admin burden and provide access to essential support, from clinical trial staff to data analysis. 5. Build capability through training and mentorship. Create more entry points, more guidance, and a stronger pipeline for clinician researchers. Clinician researchers improve care, drive innovation, and save lives. Let's invest in the system that supports them.